Good morning, April 20th. Wonderful Monday morning. I just wanted to talk about some updated coronavirus numbers, COVID-19 numbers. So this is John Hopkins. Uh, they are reporting 35,314 deaths, but this looks like it has not been updated since yesterday. So I'm not sure when exactly they do their updates, but I want to talk about a couple places that reported different numbers and the discrepancies in the numbers. I've talked about it a couple times already, but a lot of people are, you know, they keep talking about this death toll number, and it's like they're using it to push their own political agenda. Like each person does, and then you get these politicians that, oh, we got this many dead, and you need to, um, social distance, and you can't have gatherings, and you can't have people over to your house, and you have to wear masks out in public, and like all this stuff. And I feel like they're using this number, and they're instilling fear in people with this number, but this number isn't correct, and a lot of people, they're not getting that, and they're not taking the time to educate themselves and look into, hey, is this number really correct? Is this really what is going on? Instead of reporting the good side of things, I feel a lot of times the news, they report the bad side of things. Um, it's like that's what they figure that's what people want to see, people want to hear, so they don't report the good things or the unpopular things. So, like I said, this is from John Hopkins, as you can see here. This is an update from yesterday. That they haven't updated their numbers as of today yet. So I wanted to show you. Go over to the Washington Post, and their number is 40,683. People died from the coronavirus in the United States. And then you scroll down, okay, and they have this number here, this little graph here, of how many deaths were reported. Okay, go to all of U.S. Okay, now one thing I see here is the spike in mid-April is due to New York City authorities adding probable cases to the city's death tally. Now, if we go to, let's scroll down and see what New York looks like. Alright, so that's probably a combination right here of what they're talking about. So you've got the state of emergency on March 7th, March 22nd. You've got Cuomo's pause order. Alright, and then the worst day would be here. It would be the 16th, 3,215 deaths reported. So, if you look at what Reuters, let me go back up here. So, if you go to what Reuters has posted, now this is as of April 20th, 9:44. So right now it's about 10:05. So that's about 20 minutes ago. All right. Reuters. Okay, Reuters is reporting. Okay. 40,588. Okay. I believe they do their updates twice a day. Yeah, update at least twice daily, 2 p.m. and 8 p.m. Eastern time. Okay, and they say these numbers, COVID-19 cases as of April 19th, 2020 at 11:55 p.m. All right, So we scroll down here, cumulative reported um, cases. Okay. And then I like how it says includes confirmed and presumptive cases. All right. So, and if you look at cumulative confirmed deaths, all right, April 19th, 40,588. All right, so, no, on April 14th, New York City began reporting probable COVID-19 deaths, which accounts for the spike in deaths at that time in the chart above. These cases include individuals who had not been tested for the virus, but whose cause of death was listed as COVID-19 or an equivalent on their death certificate. Does anyone see a problem with that? Okay. Individuals who had not been tested for the virus, but whose cause of death was listed as COVID-19 or an equivalent on their death certificate. Okay. So they don't know that they had COVID. They're assuming that they had COVID and classifying their cause of death as COVID. Okay. All right. So let's go to this news article. Right. Bloomberg.com. All right. New York City. It's 3,800 probable virus victims to death toll. All right. And you go down here. Freddie Goldstein, press secretary to Mayor Bill de Blasio, said Tuesday that the data include at-home deaths of people suspected of having COVID-19, the disease caused by the coronavirus. That judgment is based on reported symptoms, including cough, fever, and shortness of breath. Okay? So, if you have cough, fever, and shortness of breath, automatically you have COVID. Okay? Tested or not. All right? This doesn't make any sense. So, let's figure out what my internet is doing here. This is just crazy to me. Okay, so let's see. There's another part I'm gonna show you. So right here. So no, that's not it. Died by hospitalized. So let's go to this other news article. The New York Post. Okay. So this is another news article on the fact that New York City has added these presumptive cases to the death toll. Meanwhile, they don't know if they had the virus or not because they weren't tested. So this, in New York City's coronavirus death toll surpasses 10,000 with a new tally of home deaths. Okay, so this is what I was looking for right here. Probable coronavirus deaths were more common than confirmed coronavirus deaths among victims ages 75 and older, according to the city's health department. Okay. This when it comes to counting these deaths, it should be confirmed cases only, not assumed, not because you don't know if they had COVID or not. There are numerous people that I know of that have these symptoms. Okay, they've gotten tested, and the tests have been negative. So how can you just say, "Oh, they have it"? Well, they've been tested, and the tests were negative. That's kind of a reckless way of doing things and an inaccurate way of doing things. And I think that's just not enough people are pointing out that their death toll number is inaccurate. I wish more people would. So that's all for now. I had a couple other things I wanted to talk about. I was going to do one video for everything, but the other stuff I'll make another video and talk about later. This I just wanted to talk about because this was specific to the coronavirus, COVID-19. So if you like my videos, subscribe, like, comment, share these with friends. If you get somebody that's, well, the death toll is, XYZ, tell them, no, it's not. It's lower than that. And if they want to argue with you, okay, share this video with them, okay, and show them, no, that number is incorrect, okay, by their own evidence. They're proving that these numbers aren't correct. Okay, they're blatantly saying it, and nobody cares. People just, okay, all right, that's what they're telling me. Then that's what I believe. Okay, so tell them, hey, these aren't correct. Okay, they want to dispute it. Say, here you go. Here is proof of the contrary. Okay, and see what they say. Chances are, they'll tell you you're wrong, or the famous Democrat response, "Oh, you're racist" or whatever. All right, but you'll know that you are correct. Okay, in saying that these numbers are wrong. Okay, the the truth is on your side. Okay, so have a good day. Stay tuned for more. I got some other things that I want to discuss that I want to talk about. So be watching for that video, and I'll see you around.